types of fibroids, because understanding the type of fibroid also helps us to know the symptoms that a woman is likely to present with. Can you see the picture I'm sharing on the screen?
Yeah.
Yeah. So you see on this side is a uterus that does not have fibroid. So this is the outer part I was talking about. Can you see my cursor moving? It's like
Yes,
something
we can.
like, it's like the boundary covers the womb. This place I'm moving is the muscle. This is where we call myometrium. And this inner part is what we call endometrium. So this is the part that prepares for pregnancy every month. And each month that we don't get pregnant, it is the preparation that happened here that comes out as our menstrual flow and the bleeding. Now, oh, I need to go back. Sorry. I'm moving faster than I. Okay, good. So now when we talk about types of uterine fibroids, it's based on the location of where the fibroids are. You'll see this one is closer to that serosa. It's outside of the womb. It's just to that outer covering. This is all the ones we call either subserous or pedunculated uterine fibroids. We have some that can be inside. You see, this one is even sitting where we see our period from. This is intercavitatory. Now look at this one. It is not fully inside, but it is pushing that layer where we have our period from. Those are submucous. And then this one and this one, they are all in the other bodies, but you can see that they are not touching the lining of the womb. So the location of the fibroid and the type of fibroid that a woman has, we also have a medical one we use to categorize it called the Figo staging, but that one is not even for the scope of this lecture, is to know that fibroids can happen in different parts of a woman's body, uterus. So you see this one, it's outside. This one is in the body of the muscles. This one is in the lining of the womb. This one is here. This one is even passing through the cervix, where babies are supposed to, cervix are supposed to close together when a woman is pregnant, or where babies are supposed to be locked in when a woman is pregnant, or where sperm is even supposed to pass through. This is what a fibroid is. Why am I showing you the different types of fibroid? I'm showing you this so that you know that if you have a friend that has a fibroid and you decide that I want to use what my friend used, or my friend is not taking treatment for it, why should I take treatment? Is to know that you may both have fibroids, but different women have different manifestations and locations of fibroids. What are the symptoms of fibroid? The number one symptom of fibroid is no symptoms. Why do I say this? You know, we've already established that it's very common. About 7 or 8 out of 10 women will have it. But you see, out of those 7 or 8 women that have it, only 2 or 3 of them will have symptoms, meaning about 4 to 5 of them are asymptomatic. A lot of women, when they find out they have fibroid, maybe they went for scan for something totally different, and then it's an incidental finding. It is just there. It is not disturbing them. It is simply something that exists in their body. No symptoms, no manifestation, is not affecting their period, it's not affecting their reproduction. So that is the most common one. Now, for women that will now have symptoms, we have a lot of variety of symptoms, again, based on location, based on size. All those ones that are inside the lining of the womb, those are the ones that are associated with heavy and prolonged bleeding. So menorrhagia means heavy bleeding. Anemia, imagine you're losing blood every month, you're bleeding for more than the 3 to 7 days, you're flowing for 10, 15 days. Of course, your blood will start going low, so they can manifest with anemia. For some women, they have the fibroids all over and it starts getting bigger. One of the ways we measure fibroid is even to compare it to pregnancy. You hear some people, they say the fibroid is 14 weeks, 20 weeks, 30 weeks. Once it starts getting big, the surrounding organs to the fibroid are compressed on. So the bladder is in front of the womb. You have fibroid that is in the serosa, close to the bladder, it's pressing on your bladder. You find out that the woman is going to urinate every minute, some every hour. Some cannot even hold the urine because of the location of the fibroid and they start to urinate on themselves. Some, the fibroid itself will plug where they're supposed to urinate from and they will not be able to urinate. They can even come in urinary retention. Another pressure effect that is very, very important for women with fibroid is if the fibroid is enlarging and is pressing on the tube that is carrying urine from the kidney to the bladder, which we call the ureter, they can start to manifest with hydronephrosis and even constipation if it's pressing on the rectum, difficulty in passing stool or going to the toilet generally. And of course, pain, pelvic mass. For some women, they don't have anything, but because the fibroid is big, if you may touch their tummy, you can feel that there's something growing there. For some women, it can affect their ability to conceive. A lot of times I've spoken about how this can happen from the frequency of bleeding, from pain, from even staying in that cavity that I showed you in the other picture, staying where baby is supposed to stay and competing with baby, not allowing a pregnancy to happen. And of course, spontaneous miscarriage. The pain is one of the ones that is very disheartening for a lot of women. Even after a while, after a period, they have back pain, lower, even leg pain, waist pain, lower abdominal pain. It can happen. And in some more complicated cases, it can even lead to, when it affects the kidney so much, it can disturb how a woman is actually forming red cells. So when we talk about what are the things that can put a woman at risk of having uterine fibroids, I always say that the person that finds the cause of fibroid is going to become a billionaire. If you can just find, all of you, that if you're thinking of how to become a billionaire, just go and find what is causing fibroids. We don't necessarily know what causes fibroid, but we know there are risk factors. Like, what are the things that can make you have fibroids? Nobody knows, but we know that it can be genetic. In some families, their moms had fibroids, their aunties have fibroids, their sisters have. So they're kind of genetically predisposed. Age also plays a very critical role. Now, just a brief detour for us women to know that we are born with a fixed number of eggs. We don't make more eggs. But once a woman starts to see her period, which is what we call, menarche, a woman that started seeing her period, she activates a process where she starts to recruit the eggs she was born with. And every month, one or two of them mature enough for her to potentially get pregnant. Each time that she doesn't get pregnant, what she sees is a period. Now, one other thing that most people don't talk about is when all this process is going on, it is the hormone that is responsible for it is estrogen. And this same estrogen itself also is what is responsible. Fibroids feed off estrogen. So when you see people talking about age, when a woman is at the peak of her reproductive function, when she has estrogen dominance, has all of that happening in her body, and she has predisposition towards fibroids, there can be an increase in fibroids. When I was in medical school, we used to say that fibroid was commoner in women in their 30s. But we know now the fibroid is also common in women in their 20s. The youngest, I've seen a teenager that had fibroids. So was it truly that fibroids were commoner in their 30s, or is that even women used to go for scan more when they're in their 30s? So we've always talked about the fact that it's commoner in women between their 30s and 40s, but the truth of that is that now we see a lot of young women, even in early 20s, that have fibroids. Race, it's more common in Black than white people. And when we say early menarche, that means someone that sees their period early. In the olden days, people used to see their period 18, after a while it became 16, 15. Now we have people that see their period at 8 or 9. What is the implication of this? I've already told you that the hormone that is predominant once a woman starts seeing her period is estrogen. So a girl that starts seeing her period at 8, 9 started getting exposure to estrogen earlier. So early menarche can predispose a woman to it. Nulliparity. Nulliparity means not having a child. And I'm going to use this to answer the question of one of the awesome audience members that talked about the fact that people say, if you have not, please, can you rephrase that question again? I know she asked it about not having children. If the person is still here, or if you got the question completely, Dr. Ayomide.
Yeah, she said that for a person that's never given birth before, when they get a particular age, the fibroid fills the vacuum in the womb.
Yes. So there's something that people talk about with fibroids, because they say, oh, fibroid is more in nulliparity. That's a woman that's not had a child. And what is the science behind this? I've already told you that the hormone that is predominant in fibroid is estrogen. Now, once a woman gets pregnant, the hormone that is predominant is progesterone. It's progesterone that gives, what's it called? That keeps the pregnancy. So a woman that is pregnant, even if you have predisposition to fibroid, if you're pregnant, you have 9 months of pregnancy where progesterone dominance is there. If a woman breastfeeds effectively, it may even take her up to 1 year for ovulation to resume. So in a way, what pregnancy does and childbearing is that it reduces the number of years that a woman is exposed to estrogen. That's why you hear people say things like, oh, just go and have your children quickly. It's not necessarily that, because even some women that have fibroids, after they have the children, fibroid might still especially those that have predisposition will still come back, but they will have had, and if you have a lot of children, they might actually spend 10 years in pregnancy or pregnancy nursing, which gives them time. And of course, the estrogen starts to reduce with age naturally. So that's why you hear people say things like that. Also, because of the possibility of growing after surgery, You see a lot of women, once they remove their fibroids, if they're ready to have children and they don't have any other cause of infertility, they go ahead, spend the next 5 to 10 years having children, which gives them a break from that estrogen that consistently feeds the fibroids. So obesity, hypertension, and smoking. Hypertension and smoking is, no, in fact, smoking is generally a bad habit. So it's something that is never good for reproduction. Now, what is the impact of high blood pressure? Some of the theories that have been postulated for a lot of all these hormonal disorders is inflammation, consistent inflammation, and all of this is associated with hypertension. Obesity. One of the powers of adipose tissue is that estrogen that is normally produced by the ovaries in women that have big body or they are overweight or obese, there's conversion of some cells into estrogen in the surrounding tissue. So that means if a woman is obese, not only is she producing estrogen in the ovaries, our fat cells are also producing estrogen. And that's why we say that if you are predisposed, you should watch your weight. Caffeine and alcohol as well, they've been implicated in increasing the risk of fibroid growth. Vitamin D, many studies are showing that low vitamin D is associated with rapid growth of uterine fibroids, which is why a lot of people that have fibroids now, they're even supplementing their vitamin D, making sure they have enough exposure because it's been said to help. Endocrine disruptors, these are things that generally disrupt your hormones. And there's been a lot of attention on endocrine disruptors from plastic. People tell you use plastic that is safe to be able to be used with microwave. Some people talk about hair freshener, perfumes, all of those things. Make sure that you are reading that some of those endocrine disruptors are not present in them. So these are just images. So if you do a scan, sorry for the gory image. I didn't prepare you for it. So if you do a scan, this is likely how you see a fibroid to look on scan. This is what they see. And this is a womb that has been brought out to show this person has lots of fibroids on the, can you see this is even the subserous? And the last one is a picture of fibroids that have been removed in a surgery. So if a woman has a fibroid or has fibroid, what are the tests the woman with fibroids needs to do? Of course, we all know that scan is what most times we use to diagnose it. But I wanted to also quickly share here that because most women with fibroid, we don't have symptoms. I don't think a woman if they tell you have fibroids, I don't panic. You may need to do repeated scan because one of the things we've noticed in practice is that some women have fibroids that grow slowly. Like I always say, I have patients that I've been monitoring for 10 years. The fibroid is like 1 beans. Till now it's like 1 or 2 beans outside, not disturbing them, but they are checking it enough to be sure that it's not suddenly growing faster than what they expect. And I've also seen women that have checked their fibroids 1 year and then in 2 years, it has grown like times 50 of what it was when they started. So a scan is very important for monitoring to know that, okay, is my fibroid just there quietly, not doing much, or this is a very aggressive form of fibroid, growing very fast. Full blood counts, for those that bleed very often, it is critical for them to know what their pack cell volume is. One of the greatest things that affect women as we get older is cardiac diseases. In fact, for women, they don't even present the way we see it in movies. So a woman that is losing blood every month that is symptomatic, and she's like, I'll be managing myself. You may be surviving and managing yourself, but you may be damaging your heart. So it's very important to know your PCV. I'm always correct for anemia. We've talked about the fact that big fibroids can press on your kidney, liver, bladder. That's why you have to do scan, especially if you have fibroid that you see that is getting big. Hope it's not causing pressure on my surrounding organs. And also do a kidney and liver function test. I always say you should do a kidney and liver function test because no matter what, those are like the most important organs. And if you're going to be doing either lifestyle modification, assessing whether the kidney or the fibroid is not affecting the function of any of your organs, these 2 organs you must check. Vitamin D. Like I said, recent studies have been showing that vitamin D is playing a critical role. So a lot of women with uterine fibroids, we recommend that check your vitamin D. So if you need to supplement to correct it, you can go ahead and do it. I talk about hormone profile, but at least estrogen. Some want to check their estrogen level to see if it's not very high. In some clients or in some specific patients, we can even request for MRI or even CT scan, depending on their presentation. So I kind of brought this one out because again, some women know they have fibroid, but they're ready to get pregnant. They don't want to do anything. So now that we've reached to what test do women with fibroids that want to conceive do, it is very important for you to know that just because you have fibroid does not mean you won't get pregnant. A lot of women with fibroids get pregnant without any intervention, without any drama. So if a woman is trying to get pregnant and she has fibroid, don't just go and do scan. Do a full evaluation, especially maybe if you've been trying for 1 year. There may be other reasons why you're not getting pregnant, and it's not just the fibroids. So all those general tests I spoke about in the previous slide, the hormone profile, and also check your tubes. Just because a woman has fibroid does not mean that tubes cannot be blocked. So if you're not getting pregnant, don't think it's the fibroid that is responsible for it. Do all the tests that your doctor recommends to check your tube. Also check your uterus. A woman can have fibroid and it's in the body, not affecting the lining. But some people, they'll do tests and they'll say that, okay, this fibroid is actually sitting where a baby is supposed to stay. So you may have to do something, this hysterosophigrography or even hysterosonogram, case to case, depending on what your gynecologist recommend. And the big elephant in the room, check your husband's or partner's sperm. I've seen a lot of women who think because they have fibroids, that's why they've not gotten pregnant. Then after many years, they check and it's their partner's sperm that has issues. And the thing with men is they make new sperm cells 2 to 3 months. So sometimes this is something that could have been resolved years ago with medications, sometimes minor procedures, sometimes surgery, but they just focused on the fibroid and ignored every other thing that may be affecting their fertility. So for women, if a woman has been diagnosed to have uterine fibroids, of course, you must be seeing a gynecologist, but dietary modification is very critical. Processed food, it should not predominate in your food, whether it's processed meats. I know a lot of people that like shawarma and sausage and bacon and all of those jekuje. You should avoid them at all costs. So meaning that even if you are taking them, they should be like a once in a year cheat if you have to, because they also contribute to endocrine imbalance. We also talk about avoiding refined sugar. I know some people live by bread and all of that, but if you like bread, you can start introducing high fiber wheat bread and all of those things. Avoid soy. How are we talking about soy? It's a phytoestrogen because there's some food that can naturally boost your estrogen level. If you don't have fibroids and you're getting older, they can recommend it for you. But for a woman that has fibroid that responds to estrogen, these are not the food you should be eating. Now, refined and processed food generally predisposes you to weight gain. I know we've already talked that in fat cells, the fat cells can actually stimulate estrogen to be predominant in your body. So it is very important for you to avoid all of that. Limit or eliminate caffeine and alcohol. So if a woman has recently been diagnosed or she has found fibroids on scan, the first step is please do another scan in 3 to 6 months so that you can know if it's slow growing. Sometimes you check in 3 to 6 months, it's even smaller than it was, or it's the same. Or sometimes you check in 3 to 6 months, it has increased exponentially. This will help you to, even if it's lifestyle modification, you take it more serious. Do your annual check every year. Do a scan. Is this thing getting more? Check your blood level, especially if you're symptomatic. If it is in the lining of your womb, like that small space I showed, you should consider taking it, making sure that the gynecologist helps you take it out. And there are easier ways to do it that is not like the big major surgery. So I'm going to be talking about surgical methods of taking care of fibroids. So we talk about generally, if you want to take care of fibroids, there are 2 options. You can do conservative or radical. The organ that is affected or the organ that becomes fibroid is in the womb. So some women, what they'll just tell you is, I don't even want to see this fibroid again. Just remove my womb. But we know that this is not possible for women that have not completed, or this is not the first choice for women that have not completed their family size, or they've not even had children. So that is why there's a lot of attention on conservative surgery, which is myomectomy. So myomectomy means removal of fibroids. Now, how do we remove fibroids? Like I said, myomectomy, these are methods that preserve your womb. You can keep your womb once you've done the surgery. You're not removing your womb, just the fibroids in it. So we have many types of myomectomy. So we have the abdominal one, that's the popular one where you see the womb, they open it up, the abdomen up, expose the womb and remove the fibroids. But now, with technological advancement, we now do stereoscopic myomectomy, where there's no cut made on the skin. They go in through, or we go in through the vagina and go to the womb. Now, of course, it's not all myomectomies that can be removed like this. It's the one that is inside that cavity. It's almost like the way they position you to do either high vaginal sub or pap smear. That's the position, and that's where they go into. And we also have the laparoscopic one, which is minimally invasive one. So these are sort of like pictures to show them. This is an example of a stereoscopic one. Let's think about all of this again. The location of the fibroids. So this is the stereoscope that is put in through the vagina. to remove fibroids that are close to that lining of the womb. Those are the ones that are amenable to it. Laparoscopic, they go through, this one is through the abdomen, but it's just small instruments that are put in and it's watched on the video, and those fibroids are removed. And of course, this is the popular one where the main surgery is done. The womb is sterilized or brought out, and the fibroids are removed, the womb is repaired and returned back into the cavity. Now, like I said, this one is the one that is amenable for women that are tired of the womb. Maybe they finished using it, they're done having children, or sometimes it's not like they've even done having children, they're just tired of the symptoms of the fibroids. So they're like, you know what, it's time for me to hand over these fibroids. And in some cases, it's not their choice. In some cases, it becomes something that they have to do in surgery when it's not a choice between saving the woman's life and keeping the uterus. So it can happen sometimes, but this is the total solution where the womb is removed, nothing to regrow again. It's also important to shed light on non-surgical methods of caring for fibroids. You know, when we've talked about lifestyle modification, we also talk about medications. Sometimes the medications don't cure the fibroid. They simply take care of the symptoms. So if you are bleeding and you're having pain, you see that they can put you on tranexamic acid, mefenamic, just things to help you. Sometimes we put you on hormonal contraceptives, different forms of it, to stop you from bleeding. At least if you're not seeing your period, you're not having heavy bleeding, especially for those that bleeding is the predominant symptoms. Some of the medications that we use helps to shrink the fibroid. Sometimes we shrink it before surgery and all of that. But all of them is not something you can use for the rest of your life. If you're diagnosed with fibroid at 25, you're not going to be shrinking the fibroid till you're 30. Those are like temporary measures that we can give, especially in women that have symptomatic uterine fibroids. And like I said, a lot of this is contraception. So if a woman is trying to get pregnant and we're not giving you contraceptives to stop you from bleeding, you're not going to be able to achieve conception at those during those periods. So it's something that a balance has to be struck dependent on what the woman is desirous of. Now, supplements, like I said, vitamin D, low vitamin D has been implicated in a lot of hormone-related medical conditions for women. So women that have fibroids, especially those that don't have like major symptoms or mild symptoms or asymptomatic, vitamin D has been, check your vitamin D level. If it is low, please correct for it. Vitamin B12, I don't like pronouncing this word, but I'll try. So epigallocatechin gallate, epigallocatechin gallate is a component of green tea, and multiple studies have shown that it actually has capacity to shrink fibroid. Now, see that I'm not saying cure, shrink, reduce fibroid burden, and even inositol in some studies that if the woman uses for 3 to 6 months, there's actually significant improvement in symptoms, reduction in fibroid volume. So based on case-to-case variability, some women actually benefit from using supplements. Some actually even use it post-myomectomy to reduce the chances or the rate at which they have if they are going to have a regrowth. Now, we also have all those ones we consider, they're also non-surgical procedures. Uterine embolization, where the blood vessel that goes to it, the lining of the womb itself is embolized. So it's like they're cutting off the blood supply to the fibroid. It's not every woman that qualifies for it. So it requires that you and your gynecologist have a very important discussion on side effects and if you're a good fit for it. We also have endometrial ablation. Endometrial ablation is the one that is that lining of the womb, especially for those that have heavy bleeding, it helps to manage it. We also have the one that uses equipment like MRI and focused ultrasound scan to actually blast off the fibroid nodules themselves. So these ones are non-surgical and there are also methods that can be used. But like I said, it doesn't apply to every woman. So now, uterine artery embolization, this is just a picture of it, showing how we embolize the blood vessel going to the uterus. So when there's nothing to feed it, into the fibroid rather, when there's nothing to feed it, it shrinks up that fibroid, but it's not for every woman. Now, so this is endometrial ablation that we're talking about. And this is the MRI guided one as a method of taking care of uterine fibroids. So thank you very much. If you have any questions, let me first hand it over back to Dr. Ayomide, and then when we have questions, I'm happy to take them. Thank you.
Wow. Wow. Thank you very, very much for that session. That was very, very straight to the point and clear. Please let's give a round of applause to our host again for this wonderful session. Like it was. I'm glad that she was very particular about answering questions because we have some questions even from the registration. Wow, I love the comments. I love the comments. Let's keep it coming. Thank you, Ma. Really informative, amazing, educative. Okay. Thank you, Ma. Yes, yes, yes. Thank you so much, Ma, for your time. Thank you. This was very, I hope we're learning. I hope we're learning. I hope you are writing something. Hope you are jotting. Okay, so we'll be going straight to the question and answer because I know a lot of women have questions. Fibroid is a very common topic, even in the buses. There's no bus that enter in this Lagos that they are not selling one drug that's treating fibroid and discharge at the same time. The same drug that is for fibroid is the same drug that is for infertility. So thank you very much, Ma. Uh, okay, so let's start with the questions. Is there any question? Is there any participant that has any question here? You can raise your hand. You can raise your hand or drop it in the chat box. You have questions. Okay, so questions are coming in already. So the first question here says, the scan mentioned to diagnose, is it the TVS, transvaginal scan? That's the first question. There's
So,
somebody.
so let
Okay,
me take the question so I don't forget or we don't forget them. So
okay,
for
ma.
the TBS, you can be diagnosed of uterine fibroids with any model. It could be pelvic scan, it could be transvaginal scan. It's not the route may be closer in some cases, but some women are not sexually active and they have uterine fibroids. So whether it's transvaginal, whether it's pelvic scan, both of them can equally pick uterine fibroids.
Thank you, ma. So the next question here, you can raise your hand if you have questions, then I would call you to unmute. So we have a question here. Please, what supplements can one take when conceiving after myomectomy? So I think this person is planning to conceive and has had the myomectomy done before.
So there's really no. So if you've had a bit of delay and the fibroid is like has been part of what they said you should take care of to conceive, I'm hoping that you've evaluated yourself fully for delayed conception because, like I said, a woman that has fibroid tends to think that, oh, it's because of the fibroid I'm not getting pregnant. But you can't have fibroid and have other causes of infertility. So you have to first rule out that there's nothing else because genuinely, if there's nothing else, it's not the supplement that will make you get pregnant. But if you had a fibroid surgery, maybe your ovarian reserve is low, or maybe you have blocked tubes, or maybe you have PCOS, or maybe your husband's sperm parameters are suboptimal, then the fact that you've had a myomectomy does not mean that conception will come immediately. So for the person that is asking that, I'm hoping that you've spoken to your gynae and they've done all the complete evaluation to be sure that there's no other thing that is like explained. So if you've done the myomectomy and
Ma, can you hear me? Is it my network? Am I audible? Is there anyone that can hear me here?
Yeah, we can hear you.
Oh, okay, okay. So I'm guessing it's probably a network glitch that's happening. I think she'll join us shortly. She'll join us. Okay. Are you back, ma? You're
network,
muted. Okay, okay. Yes,
I'm back now.
yes.
Yes.
Welcome back.
So like I said, one has to have your complete clinical history to be able to make recommendations on how best to help achieve conception.
Okay, great. Thank you, ma. So we have, wow. I'm getting more questions. Okay, so the next is, how is fibroid different from ovarian cysts?
Fibroid is on let me see if I can share my screen again. That will help to sort of know where the locations are. Okay. Can you see my screen? So this place that I'm showing you, can you hear me and see my screen, right?
Yes.
Okay, so this is the womb. These are the places that is affected by fibroids. All these places I'm showing you. Now, this here is the ovary. A woman that has a cyst on the ovary will have a cyst here, right? So one is happening on the ovary, one is happening on the body of the womb. So that is how you know the difference between both. So they're not the same thing. It's just that both organs are in the pelvis, then the lower parts of a woman's reproductive place, they're side by side, they are close to each other. But when a woman has an ovarian cyst, it's happening on the ovary. When a woman has fibroids, it's happening on the womb.
Great. Thank you very much, Ma, for that. So on to question from Gifty on nullity as a risk factor. How can a young woman manage not having kids and keeping fibroid away? She's the same
So
person that asked about the age.
yeah, so it's quite, I understand that's actually one of the challenges. Like, okay, so I'm young. If you've not been diagnosed with fibroid, choosing a healthy option, like I say, is a win-win for women. All your reproductive health, from menstrual regulation, menstrual cramp, mood swings, PMS. So if you don't have it, just live like the best version of the healthy life a woman can live. But if a woman already has fibroids, she's young, she has not had children, and all of that, it is imperative that you embrace all those lifetime modification. You should also explore using all those supplements. Even if you don't, make sure like the way some people love tea, you should love green tea. Like even if that's like the basic minimum you
Mm,
can do. Vitamin D, is that you supplement or you make sure that you go in evening or morning sunlight and make sure you move in it for like 1 hour a day so that you're sure your vitamin D is okay. You're also doing your scan regularly. At least when you're first diagnosed, 3 to 6 months, sometimes 6 months, 1 year, you will know whether it's slow growing or it's fast growing. However, of course, if you have symptoms, nulliparity is not going to prevent you from needing care in some cases, especially if the symptoms are disrupting your quality of life.
great. Thank you, Ma. So the next question is, I hear about seeds too. Pumpkin seed, sunflower, flaxseed. What is their impact on fibroid or fertility?
So I always say something to when people ask me these questions. So one of the things you will know is that there are different aspects of medicine. We have the orthodox medicine, we have the Western medicine, you have Chinese, you have herbal, you have traditional. If you go for people that have experimented or fully explored the use of seeds or alternative methods of taking fibroids, they may say, okay, you can use it. But for us that are practicing mainstream medicine, these are not components of our own training or one of the things that makes standardized medicine different is the ability to reproduce results. Meaning, if I give all these women these things you mentioned, they are going to give me the same response. And we can't do that with a lot of those things because it's not in the scope of our own work. So I really don't say they don't work, but I don't know because it's not my own core area of specialization or training. I've seen women that have used it or heard and they say it doesn't work. And some women will tell you that they use it and it worked. But that is not because a doctor prescribed flaxseed, pumpkin seed, and all of that for the use. But there's word on the street of Google, word on the streets, and even some naturopaths. They've also researched fully and they share their studies that those things work. But for me, that would not be what I would recommend if I was to like managing a woman for uterine fibroids, just because it's not the scope of my work.
Thank you very much. Okay, so I was thinking of giving you like a short break, just like a water break to take water, and because you've been talking for quite a while before we come back to the question. So while we are allowing our doctor to just take a short break, I'll just be talking about. Thank you very much, ma'am. I'll
I
quickly share
appreciate the
my
break.
screen.
I'm even taking it without saying bye bye. Thank you. How many seconds time should I be back?
No problem. Like 5 minutes.
5 minutes is good.
Okay. Thank you, ma'am. Okay. So while we are allowing Dr. Lewu to take a break, I just want to quickly introduce or talk about our community. You would have been wondering, okay, where is this coming from? What's this about? For people that have never heard about the community before. So I just want to briefly talk about our community. So we have a women's health community. We call ourselves the wellness queens. And the goal is to empower women through health and connection. And this is how you can connect with us on our IG page. It's actually a new IG page, so they have a lot of followers. So don't be surprised when you open it. So what's the vision? The vision is to create a world where women are informed, supported, and empowered to take charge of their health and well-being. So, and that's why we are having something like this webinar, to ensure that you have the right information, you are empowered, and you can take the right decision. So what's our mission? The mission that we have is to offer a supportive space where women access trusted health information, share real experiences, build lifelong wellness habits through community, conversation, and education. So, and as with what we are saying, we've had people asking questions about their experiences, and we are answering questions. We have a community where people can talk about and discuss, oh, this is how it happens for me. Oh, am I the only one? And they're like, okay, no, you're not alone. No, it happens like this for me. And you can feel seen, feel like you're not alone, and just have that conversation with other women that like minds. Then what are we about? So what is the community exactly about? So it's a safe space, an inclusive community focused on women's physical, emotional, and mental health. We have weekly health talks or discussion and question and answer sessions even after the health talk. Then we also have monthly expert-led seminars like this that we're having. So this is one of the events that we hold, monthly health talk. We had one last week with also a consultant gynecologist, and we also ensure that we have a safe space for shared story to support one another and even for healing. What activities do we do? Weekly health talk and discussion to share insights and create dialogue, help women to get more information about their health, everything and anything that they need to know about their health, particularly their reproductive health. Monthly webinars for expert education, like now that we are having Dr. Abodede Lewu to talk to us about fibroid. She's an expert in that field with vast experience, and to also allow for interactive question and answer session. We also have ongoing community chats for peer support and informal connection. So from time to time, we chat, we check up on one another, we ask questions, and we just, connect. What are our core values? To empower through knowledge, body autonomy and awareness, inclusivity and compassion, and respect for diverse experiences. Irregardless of the experience you've had, we respect your experience, we respect you, and we respect your decision. So who are the women that we serve? Women that are aged 18 to 16 plus, as long as you are within the reproductive age. 60 is included for women in menopause, experiencing differences or changes, menopausal changes, and that's why they're included. But we focus more on women in childbearing age. Then women across various age stages, teens, mothers, profession, diverse, kind, not just because you are in healthcare or you're a student, whatever it is that wherever it is you're working, whatever stage that you are, we have community, we have the communities to serve you. And what is the common goal of these women that are coming together? To prioritize health and share wisdom. So we prioritize our health. We are in a community or in a society where most times people want to prioritize party. You can spend money to buy a shebi, but we don't really remember to save money or keep money to get good food. Be conscious of taking green tea instead of taking Milo, just to ensure that you are staying healthy. Then how can you join us? How can you support us? You can join the community if you like to be a part of us. You can also partner with us if you have events or a webinar, you have a group of people that you want to talk to. You can also partner with us. You can spread the word, tell people about our community, tell people about the community, people that would love to join the community. You can tell them about it. You can also sponsor events or initiatives that you have, share with me as the host, and we will ensure that that idea that you have comes to a reality. So once again, follow us on IG. And if you'd like to join the community, I'll be posting a link on the chat box to a link for you to fill a form on how you can join the community. Once you fill that form, you'll be onboarded straight to the community. It's not a difficult process. So thank you once again, and you should remember that when women support each other, incredible things happen. So thank you. I think we already have 5 minutes to welcome our speaker back. So thank you. I'll be dropping the link to join the community if you like to join the community. And I also wanted to mention that some of these tests that Dr. Lewu also mentioned, even while she was presenting, she has a clinic where you can always walk in, run this test, and even get consultation as regards your reproductive health. It might not even be fibroid, it can be something else, it can be fertility, or it could even be for a friend. You can always refer. And at the end, I'll be sharing our social media handle so I can reach out to her and connect even after this. So, are you ready for us?
I am.
Okay. Yes, thank you very much, Ma. Okay, so back to the questions. Where did I stop? Okay, I've gotten it. So we have a question from Mars. What procedure would be the advisable for a submucosal fibroid?
So depending on the size and even the site of the submucosal fibroid, we now have procedures that can be done vaginally to take care of it. But remember that the woman has to be assessed. Is that the only fibroid she has? Or she has submucous fibroid in addition to like multiple other fibroids that needs to be taken care of? But if it's just a lone fibroid, submucous in nature, with 50% closer to the lining, we have like a criteria list we use to determine if that's the best method. But if that is it, it can be removed through hysteroscopy transcervically. That's through the vagina. But like I said, it depends on case to case. What's the size? What symptom is she having? And all of those kind of things will come into play.
Thank you, Ma.
Sorry, I wanted to answer. Sorry.
Okay, go ahead.
Can I answer? Okay, hello. Thank you so much so far. I am the victim. So I think
You're not. I'm just a woman with fibroids. Please don't be a victim.
like
Please.
okay, I found out 3 months ago that I have fibroid, which was so disheartening. For a long time, I used to have like terrible menstrual cramps and long period days. I never really bothered until I was just lying down one time. I was just like punching into my stomach, and I noticed that there was like a big lump. Like you can feel the lump, but if I stand up, you won't see anything. My stomach is flat. Everything is okay. But I noticed that I get tired. Sometimes my back would hurt. And then when I went to this doctor, he was like, okay, maybe you should do a scan. And then I found out that I got 10 centimeter fibroid and it's submucosal. So now that I've figured out that I have it, my brain won't stop thinking about it. And every other thing that's happening to me, I think is fibroid now. So I'm really now tired. I want to take it out. So I am now looking for a less invasive procedure. I mean, I don't want to have so much cuts on my belly and all that. I know that that's not like, I'm not coming from the aesthetic point, but the fact that
But
someone is going to cut
that's a
you.
real concern too. Don't worry. It's we
Okay,
recognize it.
okay. Thank you for validating me. But anyways, I'm really looking for a way to take it out without the other complications, because I've been reading and doing my research, and I noticed that sometimes there other concerns around, like, okay, would you be able to do some things they're not able to do? I'm not really so big on childbirth, right? I'm not really crazy about that, but I'm just thinking to myself that I want to feel much more better. Although I noticed that I can be anemic sometimes, so I've been taking supplements for 2 years, even before I noticed that I had this fibroid. So I'm really trying to now look for like ways to really, go into it, do consultation and see if I can take it out. Honestly, I don't want to have to go through this anymore. So that's why I'm just trying to see the procedure that will be better, that is not overly so traumatic for me. So yeah, thank you. Sorry, everyone.
Yeah, it's fine. Thank you so much. Thank you for sharing. Uh, it's a lot. I totally understand. It's not I mean, it's distressing. Like I said, beyond even symptoms, there's psychological distress as well. And then it now becomes like the focus of your thought process. Like, okay, what am I going to do about this fibroid? And you are particularly symptomatic. So I think it would be great. You need a proper review to decide what the next course of action will be. But like I said, 10 centimeter is quite big, but I mean, we'll review the scan. Where did you do the scan? Check and make the next call on what your options of care are. And again, is that the only fibroid? I don't expect you to share like your whole medical history here, but again, that's why you now need the proper session so you can kind of know the next steps to take. Thank you for sharing. Yeah,
Right.
thank you.
Thank you so
I've
much.
been
I would
wanting to ask fibroid.
reach out. Thank you so much. I would reach out to see what next steps I can take. Thank you.
Yeah, that's
Great, great. Thank you, Mazi, for sharing your story. That's very bold. So we're going to the next question. Okay. From Obiora, is an ovarian cyst a fibroid? And what are the dangers and solution? I think you've answered this question.
yes, I have.
Yes, yes. So the next question is, what's the risk analysis when fibroids coexist with ovarian cysts? Seems like we have a lot of ovarian cysts.
So I don't think it's like a risk analysis thing because again, what are ovarian cysts? Sometimes what we know in practice is that what do they mean by ovarian cysts? In fact, for most women, when you have ovarian cysts, the first thing we tell you to do, especially when they are simple cysts, is that you come for scan every 1 month. And then in 3 months, for a lot of women, their body has taken out the cyst because it's maybe when you were growing eggs in your previous cycle, some of them just grew too much, and then your body takes care of it. But are they complex? If it's complex cyst, sometimes is it that something is bleeding into your ovaries? Is it that then we check some markers to be sure that there's nothing abnormal that is growing there? But what someone that has something like that coexisting together is to first know if it's a simple cyst, it may just resolve on its own. If it's a complex cyst, the next step is to evaluate to know what it is. It can be a complex cyst that requires to be taken care of, or some that you probably not have to. So it's not something and then the fact that it's coexisting with fibroid, it's just that it's almost like you have two different things happening to you at the same time. But it's not like, oh, if we want to evaluate it, we'll now evaluate the two as a single entity. It just so happens that some women do have them together. But I do say sometimes that whatever hormonal pattern you have that predisposed you to the fibroid might also have been the same thing that predisposed you to formation of cyst. But if it's a simple cyst, if it's not big, because even cyst, there are some sizes that if the cyst is smaller than that, we are not supposed to do anything about it. So again, it depends. It's not all because I've seen women that will come to the clinic and they're like, oh, I have ovarian cyst. And they might check it's actually a functional cyst. That is like something that happens in the process of you growing eggs. So all of that will depend on what the woman has. So it's not a hard and fast rule. There's no risk assessment to say, oh, but if the cysts are now big or maybe you're symptomatic, you're having torsion and all of that, those are different things.
Okay, thank you very much, Ma, for that. Someone is asking if you can get the recording for this wonderful lecture. Of course, yes, you get the recording. The link will be shared via your mail or an WhatsApp message. What do you recommend for a young lady who has not conceived with these reports? Multiple hypoechoic masses within the myometrium measuring 36 mm by 24 mm by 31. That's submucous. So the person has submucosal, intramural, subserous, and fundal uterine mass, right?
Yes. So this wonderful person, how long has she been trying to get pregnant? Has she done all the other tests to check for why am I not conceiving? Has the husband done his test?
Oh.
Do we know the sperm parameters? If the person has done all of that, I mean, I didn't get the size you said was for submucous. It may require intervention to take it out. But I don't also say, because again, in practice, I've also seen people that have had multiple fibroids and we find other reasons, and by the time we treat the other reasons, they may get pregnant even before you take care of the fibroids. Yeah, I don't remember the size of the submucous, but I've had enough experience to realize that a woman with fibroids tend to not evaluate completely for delayed conception. So until you've done all of that and everything is okay, then we can say it's the fibroid that is responsible for the delay in conception. So the person still needs a complete fertility assessment, fertility potential assessment, excuse me.
Okay. So this question, I think, is either a yes or no. Can ovarian cyst cause blocked fallopian tube?
So it's a yes or no, because it depends. What is the size? What type of cyst? Like we just talked about it right now, that some women have very big cysts that is even compressing. So when you see the picture of the womb, how they separate everything in the body, everything is lying down on one another. So some women can have cysts that is so big that is compressing all the parts of their like suppressing all the organs around there. But most times what causes tubal blockage in our own environment is infection. Infections that damage the tube, leading to hydrosalpinx, and the tube heals and fibrosis and blocks. That's in our own environment, or any inflammatory process that is happening inside, or endometriosis and all of that. But the ovarian cyst in itself, I don't know how you can say, oh, because I have cysts, that's why my tubes are blocked. The tubes may be blocked as a matter of something that is happening on its own. I have a call coming on my phone that I need to pick, so I'll be back in like 2, 3.
Okay, Ma, no problem. So while we wait for Dr. Lewu, we have about 2 to 3 more questions. Then we have some questions from the registration. Some have been answered. I'll just take a few more. But quickly, while she comes back on, I've shared the link to join the community. If you'd like to be a part of the community, I'd like you to follow the link to. It's a very short link. There's some questions there that you might not need to bother about again because we already have our name. Except if you have something sweet for us, Sha. We have our name as Wellness Queen. So you have something, sweeter than that. You could also share it on the form. Then we'd like you to also follow us on Instagram. You want to follow, connect, and at the end of the session, I'll also be sharing information to connect with Dr. Leo. Then also, if you are in Lagos, you stay around Anthony, you're not far from Anthony. Tomorrow there's going to be a physical fibroid awareness seminar that would also have, let me quickly check the flyer. So it's going to be happening at OBS Women's Clinic. That's Dr. Lewu's clinic. So it's like an outreach actually. So like a fibroid awareness outreach that I'll be holding at Anthony. Let me share the flyer so that you can see it. Okay, so while I share the flyer, I'd like to get anyone's feedback from today. How are you enjoying the webinar? How has it been for you so far? You can drop it in the chat
Hello,
box.
ma'am.
Yes, I'm with you.
Can you hear me?
Yes, I
Can
can.
you hear me, please?
Yes, I can.
Okay, thank you very much. Good. And thank you for all that you and everyone else, are doing. This is a very vital information that you all are sharing. Thank you very much. Please, I asked a question. I typed a question on the chat box. I've not gotten a response yet. Yeah, so there was a part where the doctor mentioned, I think, green tea. At that part, the network wasn't stable. So, and then Milo, I'm not sure if I heard that correctly. So, I don't know if what I heard was correct, that green tea and Milo would reduce fibroid. Is that correct? Please, could you throw a little light on that, or you could type it. I don't know. The network over here is not stable. Thank you.
Okay. Thank you. You're welcome. So I think I was the one that mentioned Milo. I was talking about it when I was presenting, talking about the community. However, on the part of green tea, Dr. Lewu mentioned that green tea have been found to help reduce the risk of developing fibroid or even it growing to get becoming bigger. So she mentioned some things that like dietary modifications that can help, reducing fatty food, um, exercise, reducing caffeine or alcohol in food. And she mentioned taking, so instead of taking just regular tea, green tea help to reduce the risk as compared to other kinds of tea. I think it's in the content, but let me see if she's back on.
I'm back on. So that was what I said. But I think when you were joking that so people that like taking Milo every day, they can just take green tea every day instead.
Yes.
Something like that. It was to that one. So yes, green tea has been said. There's a component of green tea. Some supplements, even they've sort of packed them into supplements now that has been known to significantly reduce fiber burden. So let's say you are not even buying the supplements, at least taking green tea can help reduce the size significantly or at least improve your symptom.
Thank you, ma'am. So before we continue back to the question, I was talking about the webinar. I just wanted to quickly share my screen so that you can see. So it's a fibroid awareness outreach that will be happening tomorrow.
Yes, so
Yeah.
thank you. So you're all invited if you're in Lagos. It's in Antony Village.
Yeah.
And it's just to create more awareness, and also we'll be providing wellness checks. And we have scans, but we have a fixed number of scans. So once we meet the quota, and it's free, once we meet the quota for the day, then we're done. So if you're in Lagos, if you're not far from Antony, Cheneyham, we're committed to making fibroid education accessible to a lot of people to know that they have options that they can explore in taking care of their health, especially for the women that have uterine fibroids.
Yeah. And also you can even, have the opportunity to meet with Dr. Lewu and get that one-on-one personal medical consultation
No,
that
tomorrow the one-on-one they will have tomorrow is like chaotic. So if they are good, at least they get to meet. We're
yeah,
kind of like 4 or 5 doctors available tomorrow, but it won't be like enough to do individual. You know what I mean? You know how our sessions are. But I mean, come in tomorrow if you can. We'll chat. We'll schedule something that can work so that we can kick these fibroids and enjoy ourselves.
love it. Love it. Okay, so we're gradually coming to the end, but we have just a few more questions. So does cysts affect fertility, and what treatment procedure would you recommend? Well, we have plenty
Again,
cysts.
it's the same thing. Is it
Mhm.
symptomatic cyst?
Mm,
What kind of cyst? There are some cysts that if you have it, you have to take care of it. There's some cysts that you don't have to do anything about. And can cysts affect fertility? It depends. We have different sizes of cysts. We have people that have cysts that they're so big, they cause the ovary to turn on itself. Once that keeps happening, it will be reducing the blood supply to the ovaries. So yes, some cysts may require treatment. Some big cysts may be something more worrisome that has to be quickly taken care of. It depends. It's not a one size fits all. You can't tell. And sometimes it's just functional cysts that within 2 to 3 months, it disappears on its own.
Thank you very much. What is the recommended treatment for blocked fallopian tube? Just the right fallopian tube is blocked, and TTC.
So, for a woman to get pregnant, it's one tube that she needs. But we find out that how was the blocked tube diagnosed? This is something that we find very commonly in gynae practice, because if you have one good tube, and when I mean good, the tube is what makes a tube loop is not only good, it's not only that it's not blocked, is that the small cilia inside is effective, meaning that the small cilia inside can carry sperm, can carry egg, can allow conception to happen, and the woman get pregnant. But if it's one tube that is blocked, a woman can conceive with one good tube. And sometimes if the blocked tube was diagnosed on HSG, sometimes we say go and check again. Or sometimes we say you should do a laparoscopic diagnosis, because sometimes it may not be that the tube is blocked. It may have been that you had a spasm when you were doing the HSG. And it could be genuinely blocked, I'm just saying. And in some cases, have you checked the other? I've seen this thing enough. It's almost feels like I'm singing it as a song. People that will manage that, they say, oh, they have this one. By the time you do the comprehensive test, you actually find other things that is responsible for the delay. And when you take care of it, they get pregnant. So if you have one good tube, it's enough to get pregnant. If you have one good tube and you're not getting pregnant, you need a more detailed evaluation to know what is stopping you from getting pregnant. If you have one good tube and there's nothing else wrong, it's not enough to stop you from getting pregnant.
Okay, so Mazi is asking here that, can I just walk in? Sorry, my question just went. He said, please, do I just walk into the clinic and do you carry out these procedures at the clinic?
No. So I'm dropping the clinic number. It's a clinic, so we're closed. It's not a hospital. But normally, if you send a WhatsApp to this line, you chat with our booking team, and then we'll schedule an appointment for you. Now, a procedure, in as much as these procedures are simple, they're still going to be fully evaluated. It's not like they'll just see the scan and say, oh, let's go in and do this procedure. But you schedule a session, your plan will be worked out with you. And then, because some of these procedures, the time of your period that is done is different. It varies. Sometimes you can have to do some things for like a month or two before we even say, let's go ahead with the procedure. So, but I've dropped the number that you can chat with, and then they'll book you for a proper session, and then you'll plan your care from there.
Okay. Thank you very much, Ma. So we have some questions from the registration, which I think we should answer. The first question says that, how do you naturally remove uterine fibroid from a woman who is still a virgin?
I like the way that they say naturally, because what's the size of the fibroid? I mean, is this symptomatic? Like I said, there are the non-invasive ones. If the woman meets the criteria, there are multiple options that we can explore. And so in some cases, it has to be those major surgeries. Because again, whether you're sexually active or not, if the fibroid is getting big and symptomatic, it's something that a woman has to take care of.
Okay, so is it possible to diagnose yourself with fibroid without running any tests, just because of clinical manifestation observed?
No, you need a scan at least. You need a scan.
Okay. For someone that has had surgery done at 25 to remove fibroid, how do I continue to live my life without fear of I might be infertile, which is causing me to be scared of marriage? Plus, how do I make sure I don't come back? It's a very genuine concern.
Yes, so we have quite a number of women that in this category that they had fibroids very early, they had fibroid surgery. Those are the people that, you see all this lifestyle modification we talked about, all these supplements we talked about, they should be on your desk. You should be waking up green tea, afternoon green tea, going out in the evening, making sure your vitamin D is good, making sure that your BMI is okay. A woman cannot, I always tell people that the greatest test of fertility is when you try to get pregnant. You can't say, you may just get pregnant, you can't preempt fertility because you can't impregnate. You have the sperm needs to have met a woman for you to be diagnosed. That's why the diagnosis of infertility is when a couple, not when a woman. So it requires that you're in a relationship where you have tested yourself to be able to have been fertile or not. However, for your own psychological peace and mental health, you can actually go and run tests. One of the things that can affect a woman's fertility are tubes. Are your tubes okay? The lining of your womb, is it okay? Your ovarian reserve, is it good? You can actually do all these tests. If you do them and you have it and you see the results, okay, good. My ovary is fine, my tubes are fine, the lining of my womb is fine, then I'm good. So that's one of the things we also do. We have all this Ovara, Omana package, all of those things for you to just assess your reproductive potential. It doesn't mean, for women that don't have fibroids, there are women that don't have any of these things and they still have infertility. Infertility or difficulty in conception is not limited to women with fibroids. So you're still young. Don't be anxious. So the fibroid surgery, as long as it's properly done, your symptoms are resolved, you are resolved, you are living your life well. Just do the healthy options, do all the things you can, but you can do a fertility assessment. And so you can do HSG, you can do the one to check your tubes. Even the HSG will check your tubes and lining of your womb. And you can do an hormonal profile just to check your ovarian reserve. And then you can take it from there. So if you see those checkup and then the gynae reviews that's okay, fine, this looks good. And then hopefully that's enough to assuage your concern. Yes.
Thank you very much, ma. So this question is a very common question. So can diets and herbs cure fibroid permanently? Emphasis
I
on
don't know. I've already answered that already. That's outside of the scope of my work. I do know that diet and lifestyle modification improves the quality of life and symptoms, but I've not seen the person that I'm not saying they don't exist, that has been cured
cure.
by
Emphasis on the cure, not manage, cure.
I don't
Okay.
even manage it. At least it's the one that I know that I can speak for. Even manage, at least it's the protocols I'm aware of that I can talk about.
Okay, so those heavy menstrual bleeding on the first day of period from age of 35, does it mean there's an issue?
I wouldn't
Heavy
know
menstrual
because
bleeding.
it's not everybody that has it.
Mm,
There's no one size fits all approach for women's menstrual pattern. But if there's a change in your menstrual pattern, you may also want to get checked, especially if that's not the pattern you've always had as a woman.
okay, so there's someone asking here about race in the chat box.
Mm.
Let me see. That's Phoebe. Thank you, Ma. When you were talking about race, I'm not sure, but I think I heard you say it's more common in Black race than it is in probably other races. Why is that so?
It's just an observational thing. Like when you look at women with fibroids, it's more among Black women than Caucasians. There's no 100% answer to that, but one of the ones that I'm sort of aware of is the fact that Black girls tend to start their period earlier than even white girls. So estrogen exposure is earlier in Black people, but nobody can actually ascertain and say there are conditions that are also common like on Caucasians than white people. But for fibroid, there is actually more incidence of fibroids among Black women than Caucasian women.
Okay, thank you, Ma. Then I think there was a study that they said even the vitamin D level is lower in Black than white. So that could also
I need to quickly touch on that. A lot of Black people, because we live in a tropical area, a lot of us think that we have high vitamin D. Black people have very low vitamin D because because we have melanin, it reduces the rate of absorption of vitamin D. And if you're even someone that is in school or working, you're in a car or bus, from there, in the morning, you quickly go into your office. You're not even really exposed to the sun. You don't really go out during the sunny time of the day. And even absorption is not as high as we think it is. So yes, and Caucasians don't have that. They absorb vitamin D faster than Black people do. So yes, vitamin D is actually low among Black women. So don't assume that because you are living in the tropics, your vitamin D level.
Okay. Yes, thank you very much, Ma. So there's a concern here. Is it true that after surgery, one can't give birth vaginally?
Some women can't. That is the truth. Because again, it depends on the extent of the surgery. And some women, in fact, most women that have myomectomy, they don't even bother, especially if it's, even the recovery from post-myomectomy differs. Most women that have myomectomy may end up having an operative delivery at the end of the day. And for some women that even had this myomectomy, they are working with time. So it's not like you will say, okay, I had myomectomy, I want to wait for 3-4 years before I get pregnant. A lot of women that have had myomectomy go ahead and have very good, get pregnant and have a cesarean section. Most of them, yes, I agree. But it doesn't mean, we've had some few cases where that wasn't the case, but you don't want that because sometimes you are worried that you don't want the one to have some moment here, and you will be generally very edgy in labor. Labor can take hours and hours. So quite a number of women that have had myomectomy end up having cesarean section. And a lot of women that have not had myomectomy, ladies, end up having cesarean section. So remember that cesarean section sometimes is not because of the woman, it's because of the baby. So it can happen whether you've had myomectomy or not. I always tell women that there's no point in envisaging what can happen in labor. I've seen women that have had 5 children vaginally or 4, and then the 6th one, they ended up having cesarean section. So you can't tell. Some people have vaginal delivery, CS, followed by another vaginal delivery. There's no rule book. It's what is best for the mother and the baby.
Thank you very much. So would have loved to take more questions, but we've come to the very end of this session. Hopefully when we have another session with Dr. Lewu, or better still, come tomorrow so that you can have your questions to be answered. Come tomorrow for the outreach, and you even have opportunity to get scanned if you are one of the first few lucky people. Thank you very much again. So please let's give a round of applause, a virtual applause to Dr. Lewu for her time, for explaining, answering questions upon questions, giving us clarity. Thank you so much, Ma, for your time. We are very grateful. Thank you to everyone who also participated, who asked questions, who listened, and would also like to get your feedback as regards this webinar, what you'd like us to do, if there's any other topic you like us to discuss, because it seems like there's a lot of ovarian cysts. So maybe we should look into having a session on ovarian cysts. So I'd like to get your feedback. I've posted the feedback form on the chat box. Then I'll also be sharing Dr. Lewu's IG handle. Let me type it. So you can connect with her on Instagram. Please do well to follow. If you're not connecting with that to ask question, just go to your Instagram now and follow. That's the least you can do to appreciate her for. I hope I spell this well. Yes, just like let me just copy the link so that I would post the link to her page. So please let's give her a round of applause once again and appreciate her for her time. Thank you so much, Ma. We are very, very grateful. Thank you for your time. Thank you for having us. We are so super grateful. So I'm trying to copy a link and post it. Give me a minute, please. Okay. Okay, yeah, so I've sent a link. Yeah, so please do well to follow her, connect with her, follow her on Instagram, connect with her. You can even connect with her on LinkedIn, on Twitter or X, chat with her. Our Twitter handle is also Soft Life Gynae. So thank you so much, Ma, for your time. We are so grateful for teaching us, giving us the expert knowledge, experience as regards everything and anything on fibroid. Thank you very much once again for everyone who came today. Once again, we have a women's health community called the Wellness Queen. If you'd like to be a part of our community, let me post the link. You can follow the link, click on the link, and you'll be onboarded to the community. Let me post the link again. So yes, then I should also post feedback. So we'd like to get your feedback as regards the session. How was it? How was it for you? What did you learn? What would you like us to do in the next one? Yes. So quickly, just 1-2 persons. Is there anyone that wants to just make a comment about today's webinar? What stood out for you today? What stood out for you? Maze, do you want to say something? Your picture is the one showing here, so that's why I called you. You want to just say something about the webinar? How was it for you? How was the experience? Was it worthwhile? Hello, hello, hello. I think we have someone's comment here. Hey, am I audible? Hey, I hope I'm not muted. Can you hear me?
Yes. You are audible. Yes.
Okay, okay,
Yeah.
okay. So no one wants to say anything about the webinar. How was the experience for you? I think somebody said something about, I can't find the comment again. I wanted to read it out. Can't find it. Okay, should I call Gifty? Gifty, how was the experience for you? Did you learn something? Were your questions answered? Is Gifty on the call?
I dropped mine before, but I think you overlooked it. I guess because of time.
Yeah, I think, okay, yes, that was what I was trying to locate. Yes, I enjoyed every bit of it. Thank you so much, Georgia, for your feedback. I enjoyed every bit of the session. It was well detailed. I wish I knew better in 2022 about all fibroid and its awareness. I have peptic ulcer, so I just went for a scan and then I realized I had fibroid. I didn't know what to do as at then, not much knowledge, but now I know better now. Then it got bigger until I went for my last scan at AfriGlobal in January 2025. My mitral echo texture is inhomogeneous. There are about 8 well-defined hypoechoic solid intramural masses. Okay, my navel hurts badly once and during my period, menstrual cramps. Period is like bleeding process, but I haven't started reading and learning about it. I learned today also. Thank you, doctor. You are very welcome. Thank you. Okay, thank you for your time. If you were not here, it wouldn't have been a success. So thank you also for joining. Thank you for joining. Really great session. I never knew about vitamin D. It was informative. Thank you. Thank you, Obiora. Thank you, Damilola. Thank you, Maz. It was great. Loved it. Thank you, Bomondi. I hope I'm pronouncing this name well. Bomondi. I enjoyed it. Thank you. Thank you. So thank you so much for joining. Please, we'd like you to fill the feedback form to help us to better have sessions that are well tailored to your needs, what you like us to discuss, what you like us to talk about. So please fill the feedback form. Do follow us on IG. Follow Dr. Lewu on IG. I joined late. Please, how do one get the recording? Okay, yes. So concerning the recording, I'm going to be sent a link on how to access the recording will be sent to you either on WhatsApp or on your mail. So to be communicated to you on WhatsApp, and those that are already in the community will also get access to the recording. They also get a link to the recording. And if you join the community, you would also get the other benefits that comes with being a part of the community. So we have question and answer sessions, different things. And even next month, we'll be having sessions about health and finance, balancing your health and finance, how to prepare for medical emergencies, and so that it doesn't become an emergency for you because you're already better prepared. Yes. So Thank you once again for your time. We've spent over an hour, 30 minutes. Thank you for your time. So please, I'm just stalling a bit so that you can fill the feedback form. Thank you for being so open. Thank you for sharing your knowledge to help others. You're welcome. You're welcome. You're welcome. Thank you so much for joining. This is one of the goals that we have. This is one of the goals I have for women, to be able to empower women through knowledge, because a lot of women out there don't know so much about their health or even medical conditions. And it's very sad how that even people that are not so learned, talk about it like they know. So it's like you're allowing a medical doctor, be the pilot to take you to Abuja or to the UK. So you know that it's going to eventually land in calamity. A doctor cannot be the pilot to a plane. So that's just it. So you have to get the right information. And that's why we have the community to teach you, to give you access to that knowledge that you need as regards your health. And even in the community, you can also ask questions. You can reach out to me personally to ask personal questions if you would prefer not to talk about it in the community. So thank you very much once again. Let me drop the link again. Please do well to fill the form, feedback form, and follow us on. Let me check our Instagram page if they're following. Don't worry, we'll follow you back. Yeah. All right. So thank you very much for your time today. This brings us to the end of today's webinar. Thank you for your time. Do have a wonderful week and a lovely night rest. Bye. Thank
you
you.
so much for the insightful session.
You're welcome. Thank you. You're welcome.
Thank you so much, Dr. Ayomide.
You're welcome. Thank you. Thank you for joining. Thank you for staying till
Thank
this.
you very much. Bye.
Bye.
Bye, Dr. Ayomide. Bye-bye.
Bye. Just let me